New York State remains the epicenter of the outbreak in the US. The virus has killed nearly 17,000 people there. Bridget Mulrooney, a Covid-19 nurse in Harlem, New York City, has also worked as an emergency responder in West Africa during the Ebola outbreak. She told me that both emergencies require medical teams working together.
It's very much different. It's the people that are responding and how giant this epidemic is. For Ebola, everybody that went to help, they were mainly humanitarians or disaster response people. And for America response, it's anybody that has hands was willing to go. They need the numbers. Everybody's just trying to do their best.
You see what most people around the world aren't seeing. Most people might look out their windows, they'll see empty streets, they'll see closed shops. You're seeing inside hospitals, inside the front lines, and I just wondered if you can explain to our viewers what it is that you see day to day.
Absolutely. So we see a lot of the elderly population, people with comorbidities. Unfortunately, most of the people are at the end stages of life because they are in the hospital. If you're healthy enough to stay home, people stay home. What we see is people alone at the bedside, struggling to breathe, and over 3 to 4 day period, drowning in their secretions and dying alone. Or we also see the other side, it's younger people, the 40s to 50s, that come in with like cirrhosis or something else, and we call them the walkie-talkies because they can get up and move, and they usually are yelling about the TV, and then you go to check on them and they're dead. It's a horrific disease that is taking people's lives, and unless it's affecting you personally, people are not taking it serious enough.
We were looking at, as you were talking, we were looking at some pictures of you working in the US and in other places, wearing personal protective gear. That's
Sure.
your defense, that's your armor against potentially contracting the disease yourself. I mean, how much are you concerned for your own safety when you're treating your patients?
So for me, I don't know if I've had COVID or not. I feel like I haven't, but I could have been asymptomatic all along. No one knows. I'm very rigorous about wearing my PPE. I have never once contracted anything in any outbreak I've ever been in. When I'm at the bedside, I feel like I am properly covered, and I can stay at the bedside longer than people that are scared about contracting COVID. I do feel quite safe. We've been gifted giant face shields, so even when patients are coughing or have trachs and they're coughing on top of you, it's not getting into any skin that you have showing when you wear like goggles. So I feel quite safe all the time.
And at the end, I understand you do 13-hour shifts, and then you get into transport that takes you and your colleagues back to a hotel. Presumably...
I do. The company I'm with is providing transport to and from. I'm working 6 days a week.
Well, that makes me wonder how you unwind and how you deal with the kind of things that you're seeing and the stress that you're under if you're really just shuttling between work and home.
Well, there's a great support system with all the other nurses. We laugh and joke about anything that happens that's fun in the day. You have to keep the humor alive. We are in no way making fun of COVID, but you have to have a positive attitude because you want to bring that to the patients. And on my days off, it is sweatpants. I lay in bed, I keep my feet up, and I do not wear a mask because I am inside, and I enjoy every second of it. And it goes by really fast.
It's Bridget Mulrooney, a COVID-19 nurse in New York, speaking to me a short while ago.